Good morning, everyone. I'm Congressman Ritchie Torres, and I'm proud to be joined by a number of social service providers here in the Bronx and elsewhere in New York, including RAIN, Grant Street Settlement, and Met Council. As all of you know, President Donald Trump is attempting to do what no other president before him has ever done on the scale of trillions of dollars. Donald Trump is claiming that he has the absolute authority to freeze federal funds, to defund whatever program he wishes, for whatever reason he wishes, whenever he wishes. The power to defund any and all government programs is not the power of a president, it is the power of a king. Donald Trump's abuse of power violates the United States Constitution, which provides for separation of powers. Right? We in Congress write the laws, and the president is supposed to faithfully execute the laws as written by Congress. No president has the right to rewrite the laws that Congress has written. No president gets to pick and choose which laws to follow and which laws to ignore. And if we were to accept Donald Trump's argument that he has the absolute authority to defund whatever program he wishes, then what is to stop a future president from defunding Social Security and Medicare? Now, Donald Trump has publicly said that he has no intention of defunding programs like Social Security and Medicare, but pay attention not to his words, but to his actions. Donald Trump is intent on challenging in court the Impoundment Control Act, which protects mandatory spending programs like Social Security and Medicare from spending freezes. So Donald Trump is setting a dangerous precedent for the future of our country. The president's abuse of power is not only an attack on the United States Constitution, it is an attack on the lives and livelihoods, the health and safety of all Americans and all New Yorkers. Donald Trump is attempting to defund New York, which receives about $100 billion from the federal government. The state of New York receives over $56 billion from Medicaid, which serves 7 million New Yorkers. Over $11 billion for the Affordable Care Act's Essential Plan, which serves 1.6 million New Yorkers. More than $2 billion for Child Health Plus, which serves 1.6 million New Yorkers. Or when it comes to food, New York receives $8 billion for SNAP, which serves 3 million New Yorkers. When it comes to infrastructure, $4 billion in FEMA funding for disaster relief, more than $2 billion for roads and bridges, and more than $2 billion for public transit. And when it comes to law enforcement, New York receives nearly $300 million for counterterrorism to prevent a repeat of 9/11. Donald Trump is claiming that he has the authority to defund all those programs without Congress at the stroke of a pen. He is claiming that he has the authority to create a $100 billion hole, not only in the budget of New York, but in the lives of New Yorkers. There are millions of New Yorkers who depend on these programs for their health and safety. And if you have any doubt about anything I've said, just listen to the New Yorkers who are on the ground every day receiving these services and providing these services. And so I'm proud to be joined by a number of those New Yorkers, and we'll start with Anderson Torres.
Good morning to all. Just as we speak right now at RAIN, we have an 83-year-old in the ER. She was found on the floor by her home attendant. If it wasn't for that life-saving person, that service, God only knows what would be the outcome. But right now, she's being attended to. A potential threat in cut that would impact that level of service is detrimental to the home care industry. In addition to the fact that we have here one of our 98-year-old members that would also potentially be affected should there be cuts to older adults and to meals that are critical for the nutrition, for the sustainability and viability in the community.
Thank you, Congressman. Thank you, Anderson. Here today, my name is Robert Cordero. I'm the CEO of Grant Street Settlement. We're a 109-year-old institution, nonprofit institution in New York City that has always served children and families. We've survived and thrived over 109 years to lift people out of poverty. The most essential program, service that we've offered in over 100 years has helped lift thousands upon thousands of children and families out of poverty is our child care programs. Since 1968, we were an original grantee from the War on Poverty for the National Head Start program. And so we've seen for the last 50 plus years the impact of that program on helping children to prepare for kindergarten and helping families to have high quality early childhood programs. I'm a graduate of the Head Start program. I'm a result of that Head Start program. And what I want to share is that any cuts, any pauses in federal funds would ruin the work that we've done in the Head Start program, which currently serves over 800,000 preschoolers throughout the country. In this district that we're in right now, we've partnered with Congressman Torres to bring 5 new brick and mortar Head Start centers to the Bronx, to some of the highest need neighborhoods, all of which are in Congressman Torres' district, to serve 1,000 children so that they have access to the highest quality childcare. And we have staff who are terrified, teachers, of are they going to have a job? We have parents who are on our waiting list, waiting for the child care centers to open, that are terrified of whether or not they're going to have access to child care so that they can go to work, so that they can go to school, so that their children can prepare for kindergarten. So it's an absolute nightmare situation on the ground if there's any pause. Even a pause that was caused by the disruption this week has an impact on staff, has an impact on our children. And so we stand with Congressman Torres to ensure that we not only preserve but enhance all of these life-saving social services programs, including to protect and ensure that our seniors are safe with food. We have one of our senior center participants, Carmencita here, who's going to share a few words with you, but also for families in the Bronx and around the country.
My name is Carmen Sotomayor. I've been going to the Grant Street Settlement for about 20 years. I enjoy it so much. We do a lot of yoga and Zumba, birthday parties every month. We also learn about different things like computer classes we get also. The main part of our senior center is having a nutritious, healthy meal. But we are in danger of losing our funding. If we do, some seniors will go hungry. We need the politicians' help. We have the right for the funding. Thank you.
¿Algunas palabritas en español?
Una
O
palabra.
después hacemos los
Sí,
preguntas,
pues,
se aguanta porque todo
que-
viene en
que-
español.
ajá.
Para después. Ok, muchas gracias.
¿Luego o ahora?
No, luego lo hacemos luego en español.
Pues yo voy a hablar en español. Yo pertenezco a un centro de REIN y necesitamos más fondos porque hay mucha gente en la calle hambrientos. Y yo les voy a decir una cosa, para mí no va a haber second class people, va a ser los ricos y los pobres. ¿Okay? De la manera que Trump nos lleva, nos prometió muchas cosas, pero todo lo que él promete son mentiras. Así es que nosotros estamos pidiendo, la iglesia está viniendo, la gente pidiéndole a Dios que nos ayude para que este hombre cambie de parecer y sea un hombre más humano, porque él no es humano. No sé de dónde él viene, pero papá Dios nos va a ayudar a nosotros y vamos a vencer y no vamos a dejar que él quiera hacer lo que él quiera hacer. Muchas gracias.
Wasn't
wasn't prepared for this. So, hello, I'm Carolina Capellan. I'm the new Bronx Regional Director for Grand Street Settlement. We were talking in the waiting room how important Head Start is to the community. It's an evidence-based program that not only supports the community, but it's a wraparound approach. It doesn't provide just education. It provides mental health, nutrition, health, and most importantly, a second home for many children and parents. It provides a space that you can go, that people that looks like you. And a change comes within the communities with people from the community. For me, I'm a Head Start parent also, as Robert, that he discussed, and it was so important me having a special needs son and having a place that he was accepted, included, and no one made me feel different because of my title or anything. He was just a child there. And Head Start started about, we're gonna have 60 years. I started very young in my career, about 23 in Head Start, and I fell in love with it. Because not only, again, is one of the only programs that is early childhood focused, but it's parent focused, it's family focused, it's community focused, and that's what is important. Thank you.
Donald Trump está intentando robarle a Nueva York 100 millones de dólares. Las acciones de Donald Trump no son solo una violación de la Constitución de los Estados Unidos. Es un ataque a la salud y la seguridad de los neoyorquinos. Debemos proteger a Nueva York de Donald Trump. So we'd be happy to take whatever questions you have.
Two questions. The first one is there any contingency plans for federal funding that are frozen? What's being done for people in their programs? And are you looking to submit any type of federal legislation to protect DEI programs?
So, I mean, I'll have the providers speak about contingency plans, but there is no substitute for federal funding. Federal funding represents as much as 40% of the state budget. So if you have a $252 billion budget and about $100 billion is coming from the federal government and most or all of it disappears, there's nothing that fills that gap. So there's no real contingency plan. You know, the federal defunding of state and local governments and community-based organizations is the ultimate existential crisis. You know, many, if not most, not-for-profits in the Bronx would collapse without federal funding. Most funding for healthcare is from the federal government. Most funding for housing is from the federal government. Most funding for home care is from the federal government. Most funding for child care is from the federal government. Most funding for food and shelter is from the federal government. And what is at stake are not luxuries, but the necessities of life. Like, there are senior citizens who will not survive without access to federal funds, who depend on providers like RAIN for home care, for survival, who have nothing, who have no family, who have nothing but their home care attendant. And so there is no, you know, it's like asking for a contingency plan in the event of an astronaut hits Earth. There is no contingency plan. There is no substitute for the loss of federal funding.
We're talking about taxpayer dollars. It's all taxpayer money anyway. So when you say federal dollars, we're talking local dollars, which go to Washington, but are supposed to come back because everybody's paying their taxes. Exactly, and in a number of cases, these are programs that to which we contribute directly through our tax dollars. And no president should have the power to defund trillions of dollars worth of critical services at the stroke of a pen. We live in a democracy where those decisions should be made by the people and by their elected representatives in Congress, not by one dictator.
So at Grand Street Settlement, to give you an idea of an impact on a local nonprofit community-based organization, federal funding represents half of our operating budget. We provide an array of services from birth all the way through 98, 100. Feliz cumpleaños.
Gracias.
And, you know, so for us, the contingency, when we thought on Tuesday morning that there was going to be an indefinite pause on federal funds, our contingency projections showed that we could withstand 1 month without federal funding. That would be fully extending our lines of credit that we have built up over a century, our reserves, and in order to keep services going. After that, it would be dire. There would be massive cuts in programs. We would need to shutter and unwind relationships, leases with vendors, and we would have to massively lay off our staff. And so it would be utterly devastating. Even for organizations that rely on federal funding for a portion of their funding, much smaller, it has an impact because that cash flow is part of what we raise. We scratch and raise money from city, state, and federal government, but also privately fundraised money and events just to provide the mission critical essential services to the community. So at any level, whether it's 1 or 2% or half of your operating budget, it is completely devastating. We need to make sure that we have a functioning government that focuses on continuity of services and helping the most in need.
¿Usted puede decir eso en español? Y disculpe,
Claro que sí.
denme un segundito. Un segundito. Ok. Diga, porque no lo tengo esto, so, yo voy a pedir que usted me diga de la organización y...
Claro que sí. Okay.
Ya.
Mi nombre es Robert Cordero, yo soy director de Grand Street Settlement. Tengo más que 100 años de existencia en Nueva York. Un corto de si el gobierno federal corta los fondos a la gente, a la agencia como Grand Street Settlement, para nosotros 50% de los fondos vienen del gobierno federal y vamos a sufrir, va a ser mucho sufrimiento porque no es solo los empleados, no es solo las relaciones que tenemos de negocio en la comunidad, pero los participantes van a sufrir porque nosotros estamos proveyendo cuidado de salud, cuidado de niños, cuidado de ancianos y es bien difícil existir sin los fondos federales. Es imposible.
I'm Dr. Anderson Torres, President and CEO of RAIN, a not-for-profit organization that has been in the community since 1964. On Tuesday, we had an alarming reaction. One of the programs that RAIN administers is a licensed home care agency with home health aid services, which is vital for the survival of many in the community. When we heard that there was a potential for Medicaid to be stopped, this is a Medicaid-funded program. That's what funds long-term care. We thought this would be totally devastating. There was no way to really look at a solid contingency plan when we're dealing with lives whose conditions may change at any second. And the discussion was, if this happens and people aren't getting paid, then what's the end result? The end result would be that there would be a massive influx of people in the hospital ERs, which can potentially collapse and challenge any hospital system. Think about the thousands and thousands of individuals that are receiving a service like this, and for them not to be able to sustain themselves independently in the community as best as possible, dealing with their disabilities, it would be taxing the healthcare system in such a way that it would be just massive chaos. So that's just one example of one of the programs for an organization that has been committed, and that was actually the first program for RAIN to be sponsoring back in the 60s. And we have a lot of individuals with chronic illnesses, and the Bronx is the last that leads with health outcomes in the entire state, out of all counties. Not to mention the food insecurity as well, and food being a key staple of survival for many in the community, and not many have access to that. There are actually food deserts in our community, and to have organizations such as mine and others join in that plight to address that, it's addressing equity and access, and any cut will actually just derail that level of commitment that our state has so much championed over the course of years.
I represent the poorest congressional district in America. You know, when America sneezes, the Bronx gets the flu. The Bronx is going to be the hardest hit by Donald Trump's spending freeze. And the spending freeze is not only going to kill critical services, it's going to kill jobs. Right? Healthcare alone is 25% of the Bronx economy. And if you combine healthcare with social services, it's about half of the Bronx economy. And so the stakes could not be higher. In my 11 years as an elected official, I have not seen a greater challenge to the Bronx than the attempt by Donald Trump to defund critical services like childcare and home care and health care and food and housing. We cannot stand by idly while Donald Trump attempts to create up to a $100 billion hole, not only in the budget of New York, but in the lives of New Yorkers.
Just a follow-up?
Yeah.
So you were talking before about executive orders versus what Congress does, and I'm sure there are people out there that don't realize that Congress is the one who makes the laws. You mentioned it before. Can
Yeah.
you expand on that? How
Yeah.
even you could sign 100 different orders, but Congress is the one. Republic.
You learn it in elementary school, right? So that Congress makes the law, and the president executes the law, and the judiciary interprets the law. And the Constitution is crystal clear that Congress has the power of the purse. Congress has the spending power, Congress has the power of appropriation, and the president has an obligation to execute the law faithfully as written by Congress. And here you have a president who's ignoring the law, which is going to set a dangerous precedent. And so we're not going to stand by idly while Donald Trump not only attacks the United States Congress, but attacks all Americans and all New Yorkers who depend on critical services for their health and safety. Thank you, everyone.